Very warm welcome, friends, to Knowledge Park. We take over 20,000 breaths a day, a process so automatic we rarely give it a second thought. But beneath this simplicity lies a system of breathtaking complexity and elegance. Today, we will journey deep into your respiratory system. We'll start with the fundamentals that everyone should know, and then dive into the microscopic and molecular details that are revolutionizing modern medicine. Whether you're a student, a seasoned doctor, or simply curious about your own body, this journey will reveal the incredible story of every breath you take. Let's begin by mapping the system. Think of it as an upside-down tree. The conduits: air enters through the nose, which filters and humidifies it. It then travels through the pharynx and larynx before reaching the trachea, a sturdy windpipe held open by C-shaped cartilage rings. The trachea splits into the bronchi, which branch into smaller bronchioles. The bronchioles lack cartilage and are rich in smooth muscle and elastin, allowing them to dynamically adjust their diameter. The lungs and lobes. The lungs are not empty sacs, they are spongy paired organs. The right lung has 3 lobes, the left has 2, with a cardiac notch to accommodate the heart. They are enveloped by a double-layered membrane called the pleura. The pleural fluid between these layers creates a slippery surface, allowing the lungs to expand and contract with minimal friction. The final frontier. Alveoli. At the end of the tiniest bronchioles lie the alveoli. These are the grape-like air sacs where the real magic happens. If you could spread them out, they'd cover an area the size of a tennis court. Each alveolus is lined with a thin layer of surfactant, a fluid that reduces surface tension and prevents the sacs from collapsing. They are also patrolled by macrophages, the immune system's cleanup crew. Now, how does this machinery work? The process involves both bulk transport and molecular handoffs. Ventilation, the bellows action. Breathing is driven by negative pressure. When you inhale, your diaphragm contracts and flattens, and your intercostal muscles lift the rib cage. This expands the chest cavity, dropping pressure and pulling air in. Exhalation is typically a passive relaxation of these muscles. This movement of air is called ventilation. Gas exchange, the molecular dance. Inside the alveoli, diffusion takes over. The wall of the alveolus and the wall of the surrounding capillary form a respiratory membrane that is only 1 micron thick, thinner than a human hair. Oxygen, at a high concentration in the alveoli, diffuses across this membrane into the oxygen-poor blood. Simultaneously, carbon dioxide does the reverse. This is external respiration. The vital link, perfusion. None of this matters without perfusion. The circulation of blood by the heart. The oxygen-rich blood travels to the heart to be pumped to every cell in your body, while the CO2-rich blood returns to the lungs to be exhaled. The respiratory system, though elegant, is vulnerable to a range of diseases. Thanks to modern advances, our ability to diagnose and treat these conditions has transformed dramatically. Today, tools like endobronchial ultrasound, or EBUS, electromagnetic navigational bronchoscopy, and transbronchial cryobiopsy, allow doctors to precisely sample lung tissue and lymph nodes, especially in suspected cancer or complex lung diseases. Asthma and COPD, once seen as simple airflow problems, are now understood as complex immune-driven diseases. In severe asthma, we now identify specific phenotypes and endotypes, such as type 2 high inflammation. For patients who do not respond to standard inhalers, biologic therapies can target these pathways, ushering in an era of personalized medicine and improved outcomes. Interstitial lung diseases, like idiopathic pulmonary fibrosis, involve progressive scarring of lung tissue. For years, treatment was limited. Now, antifibrotic medicines can slow disease progression by blocking key signaling pathways that drive fibrosis, offering hope where little existed before. But what causes some lungs to age and scar so rapidly? The answer often lies in our chromosomes. At the ends of each chromosome are telomeres, protective caps that act like the plastic tips on shoelaces. In healthy young lung cells, telomeres are long and robust. But in diseases like IPF and certain forms of COPD, these telomeres become short and frayed, pushing cells into a zombie state called senescence. These senescent cells can no longer divide or repair tissue, and instead release signals that drive inflammation and scarring. In some families with pulmonary fibrosis, mutations in telomere maintenance genes are the culprit, making the lungs age prematurely. Understanding telomere biology is opening new doors for therapies that target the very roots of lung aging. Infections remain a global threat. The COVID-19 pandemic highlighted our vulnerability to new respiratory viruses. Meanwhile, ancient foes like tuberculosis persist, especially with the rise of multi-drug-resistant TB. Rapid molecular diagnostics and new drug classes, along with carefully selected repurposed agents, are now improving survival and outcomes for patients with resistant disease. Multi-drug-resistant tuberculosis demands a different playbook. Rapid molecular tests like EXPERT detect resistance within hours, guiding therapy early. For confirmed MDR-TB, newer agents anchor shorter, all-oral regimens, often combined with other supportive medicines. Close monitoring of heart rhythm, vision, and neuropathy is essential, but these regimens are improving cure rates worldwide. Prevention is powerful. Vaccines for influenza, pneumococcus, and COVID-19 reduce severe respiratory infections. Good ventilation, masks in high-risk settings, and hand hygiene cut transmission. After infection, pulmonary rehab, and structured follow-up help recovery, especially in post-viral syndromes, restoring endurance, breath control, and quality of life. Managing these complex conditions requires a modern, multidisciplinary team. Today's respiratory clinic brings together not only doctors but also clinical nurse specialists, respiratory pharmacists, physiotherapists, speech and language therapists, and clinical psychologists. This collaborative approach ensures holistic, patient-centered care and the best possible outcomes. Beyond the core team, specialist roles drive outcomes. Respiratory pharmacists optimize inhaler regimens and interactions. Physiotherapists tailor airway clearance and exercise plans. Speech-language therapists treat dysfunctional breathing and cough. Clinical psychologists address anxiety linked to dyspnea. Together, they turn complex care into coordinated, patient-centered progress. Let's explore the cutting edge of lung research, where technology and biology are coming together to reveal the lung's deepest secrets. First, spatial transcriptomics is like a Google Earth for the lung. Scientists can now map not just which genes are active, but exactly where each cell sits within the lung's landscape. This 3D atlas helps us see how abnormal cells interact in diseases like pulmonary fibrosis and lung cancer, revolutionizing diagnosis and treatment. Next, mechanobiology reveals how lung cells sense and respond to physical forces. In healthy lungs, cells rest on a soft, flexible matrix, but in fibrosis the tissue stiffens, activating pathways like YAP and TAZ that drive more scarring. Researchers are now developing mechanotherapeutics to break this vicious cycle and restore healthy lung function. The lung's innate immune system can also develop a kind of memory. Alveolar macrophages, our frontline defenders, can be trained by past infections or vaccines to respond faster and stronger. This trained immunity can boost protection but sometimes leads to chronic inflammation. Scientists are working to harness the good while limiting the harm. Another breakthrough involves extracellular vesicles, tiny packages released by lung tumors. These vesicles travel through the bloodstream to distant organs, preparing them for cancer spread by creating a pre-metastatic niche. Understanding this process is changing how we think about and fight metastasis. Artificial intelligence is transforming radiology. AI can analyze CT scans, color-coding patterns of fibrosis and generating risk scores for disease progression, sometimes more accurately than human experts. It's also helping detect conditions like ARDS earlier than ever before. Now let's turn to the advanced physiology of the pleura, the thin, double-layered membrane surrounding the lungs. The pleura plays a crucial role in breathing by maintaining a delicate balance of pressures. During each breath, pleural pressure changes help the lungs expand and contract smoothly, minimizing friction and preventing lung collapse. To study these subtle movements, scientists use optical electronic plethysmography, a non-invasive technique that tracks chest wall motion in real time. This technology provides detailed insights into how the chest and lungs move during breathing, helping doctors diagnose and monitor respiratory conditions with greater precision. Another frontier is liquid biopsy. By analyzing a simple blood sample, doctors can detect fragments of tumor DNA, known as circulating tumor DNA, or ctDNA, shed by cancer cells into the bloodstream. This allows for early detection, monitoring of treatment response, and even identification of genetic mutations without invasive procedures. In the lab, advanced sequencing technologies zoom in on these tiny DNA fragments, revealing the genetic blueprint of lung tumors. This information guides personalized therapies and enables real-time tracking of cancer evolution, making treatment more precise and less invasive than ever before. Finally, scientists are growing 3D lung organoids from patient cells. These mini-lungs allow researchers to test drugs and personalize treatments for diseases like cystic fibrosis. Robotic systems can screen hundreds of drugs, highlighting those that restore healthy function, bringing hope for truly individualized medicine. So, what does all this science mean for you today? Here's how you can support your lung health. Nourish your lungs. A diet rich in fruits, vegetables, and omega-3 fatty acids, found in oily fish, provides antioxidants and anti-inflammatory compounds that support respiratory health. Train your breath. Practices like pursed lip breathing and diaphragmatic belly breathing can improve breathing efficiency, especially for those with chronic conditions. Stay active. Regular exercise strengthens the respiratory muscles and improves the efficiency of your entire cardiorespiratory system. What to avoid? Smoking, vaping. This is the single most damaging habit. It destroys cilia, damages alveoli, and is a primary cause of COPD and lung cancer. Air pollutants. Be mindful of indoor and outdoor air quality. But there's more. The environment can actually change how your genes work. When you breathe in smoke or pollution, tiny particles can enter your cells and add chemical tags to your DNA, a process called epigenetic modification. These tags can turn off protective genes, raising your risk for lung diseases. Remarkably, some of these changes may even be passed on to future generations. So, protecting your lungs today can help protect your family's health tomorrow. A final word on seeking help. If you have a persistent cough, shortness of breath, or wheezing, consult a doctor. The medical department you need is pulmonology. The pulmonologist is your lung specialist, who leads a multidisciplinary team dedicated to your breathing health. From the simple mechanical act of breathing to the complex dance of cells and molecules, your respiratory system is a true marvel. It is a field of medicine that is evolving at an incredible pace, moving towards personalized treatments, multidisciplinary care, and futuristic therapies. By understanding it, we can better appreciate its wonder, protect its health, and look forward to a future where even the most challenging respiratory diseases can be effectively managed or cured. Thank you for watching. Breathe well. Live well.